practice them a little bit on the weekend. Now, remember when you're motion palpating, you're going to be in this position, squared up to the patient. You're going to keep them on your proximal knee here, and you're going to come down. Remember, to palpate the second and the third cuneiform, you have to find your navicular tubercle. You have to stabilize the navicular tubercle. You have to come right down the second and the third cuneiform, or down the metatarsal, and that'll get you to the second and your third cuneiform. Now, when you look at these, and if I can just show you real quickly on this skeleton. When I was taught this, I was always taught the third one's the only one that's going to drop. If you look at the second one, it looks like an upside down pyramid. It's like real wide and flat on the top. And then it just goes down to this little skinny point on the inside. And so we were always taught that only goes superior. And I'm not showing you the superior ones, but if anybody wants to know, I'll show you how to adjust them superior. But we were always taught just the third, and so that's the only one I've ever adjusted. But someone said you can get a drop second, which can cause a lot of problems with people with like plantar fasciitis, etc. But I've never found it on anybody, but I'm sure some people are adamant about it. It doesn't. So, but if you look at the skeleton, you'll see it's really small and difficult to get even on that second one underneath because it's so tiny, and the third one is much larger at the bottom of it. So that's how you motion palpate it, right? Up and down. And in order to adjust it, we're going to have our patient prone. Now, we just lift the patient's foot, and you don't want to bring it up to 90. You only want it about 45 degrees. Okay? So everybody got that? And again, you got to find the navicular tubercle. Put your chiropractic index finger on it. Find your cuboid, and in that way, when you come down, you got to stop just distal to them. Sorry, the probably tickles. All right, right here is where you want to be. Does everybody see? So you set up your landmarks so you can see where you are. Come down, set up. Now, basically, it's a thumb-on-thumb contact. And when you're going to make this adjustment, again, you want this at about 45 degrees. You want to, as you make the contact, you want to splay the ones this way. Okay, so what I'm doing this is I'm pulling the first cuneiform, second cuneiform, and I'm splaying them so that bone can just slide right through. Has everybody got that? Dr. Gonza used to say whenever you're adjusting anything, if you can open the joint on the side that you're thrusting to, the bone will have a place to go, and it makes your adjusting a lot easier. So we're going to go like this. We're going to separate, take out our slack, and it can be very painful. But the patient has to be relaxed. Now you can see there's a lot of control issues here because all kinds of things can happen. So you just got to be really careful. I like to keep the foot neutral. Some people like to go like this. I think it binds the joint. Just go like this, stabilize across the, just across that joint to open it up, and you're going to thrust straight through this way. Now, these will be tender inside here. Right, and I'm actually being a little lighter because I don't really want to hurt her too badly. And
too lightly, doesn't hurt her.
That could really kill that.
So when you adjust this, it'll cavitate. It'll go clunk when that moves, but it will be uncomfortable on your patient. So you have to make sure they're staying relaxed. They'll be in pain anyway because the whole bottom of the foot's going to be pain on this. And so you'll just feel it and go through it. And once you get there, don't stop. Just blow right through it, okay? Because the more time you spend on it, the harder it is for the patient to stay relaxed on it. Now, so it's the same whether you're on the second or the third. You're probably going to be doing a lot more of the third, so you'll be pulling away the cuboid on the outside when you're making the adjustment. Now, on the boards, they'll show this also for the first cuneiform. I don't think it works well at all. I think the adjustment I showed you works much better. But if they tell you to do a thumb on thumb over here, do it. But we're not going to do a thumb on thumb. You can practice it right now just to try to get an idea of it. I think it works a lot better the way I showed you. So, does anybody have any questions on this? Okay, remember, you're not trying to go like this. Okay, you're not trying to go like this. You wanna try to keep it right about there, and you're gonna just move into it with your body weight, just like this, and then splaying apart, and that way you'll control it and thrust right through. Okay? All right, so